is the time to focus on health. Americans, they suffer with either irritable bowel syndrome or chronic idiopathic constipation. But our next guests are proof that with the proper diagnosis, you can manage these conditions. Joining us now is Dr. Jack Braha and patient Blanca Escarcega. They are here to talk about these conditions. Great having both of you. Welcome in.
Great, thanks for having us.
Right.
Thank you.
So explain what IBS-C is as well as CIC.
Right, good question. So IBS-C is irritable bowel syndrome with constipation. This is where folks describe abdominal pains or aches that are in conjunction with changes in their bowel habits, in this case constipation. And that's what folks are suffering from with CIC as well, absent of the pain. CIC patients have hard to pass stools, difficulty when they go to the bathroom, or incomplete evacuation. And these are both very common disorders affecting up to 35 million people for CIC and over 13 million people with irritable bowel syndrome with constipation. But what's important to know is that 75% or more of these patients have yet to see a physician and be properly diagnosed. And more importantly, they don't know that there are good treatment options available. And that's why we're here today. As a paid spokesman for Allergan and Ironwood Pharmaceuticals, I'm here to present a good, well-rounded approach to treatment that may help your viewers.
Absolutely. Well, we're going to want to talk about that in a moment. Blanca, I want to talk to you first, though, and talk about your symptoms. You're feeling some symptoms. It prompted you to talk to your physician. What was that thing that made you say, you know what, this isn't normal, this isn't right, I have to see a doctor about this?
Absolutely. In my situation, a lot of it was the lost time with my family. There were times where we would be watching a movie and they would have to pause the movie in the middle of it just so that I can go to the restroom. And I'd be in the restroom sometimes 45 minutes up to an hour. Wow. Sometimes, and even 4 to 5 times even in a day. And going undiagnosed for 9 to 10 years, I said it was enough, and it made me open up that conversation, just a very candid conversation that I needed to have with my doctor and be honest about those symptoms so that I can get ahead of them.
No question. Doctor, that's the biggest thing. It's either a non-diagnosis or a misdiagnosis. So if you find that a person is suffering from one of these two conditions, what advice would you give that person?
Right, so the first advice is not to ignore your symptoms. Don't be embarrassed about this conversation. Please go to your physician, open up about your symptoms, because treatment options are out there that could include fiber in the diet, water, increasing your hydration, exercise. There are over-the-counter regimens which may be available, like laxatives that are intended for short-term treatment. But we know that these patients have relapsing conditions and want to get ahead of their disease. And one prescription option out there is Linzess, which is approved by the FDA for the treatment of IBS-C and CIC. It's a once-a-day medication to help patients treat these symptoms. And then follow up with your physician. Any of these treatments could have side effects, such as with Linzess, the most commonly reported side effect of diarrhea. And it's important to discuss with your physician whether or not your treatments are working, and look for other options as well. And not to remain, as Blanca did for 9 or 10 years, to suffer is just terrible.
And Blanca, you're living proof of this. If you're actually honest with your doctor, the better your odds are of having a proper diagnosis and getting to the bottom of this.
Absolutely, absolutely. Just the toughest part is getting over that embarrassment and making sure that you do open up about that conversation with your doctor.
No question. If we want more information, doctor, where do we go?
Patients out there, your viewers, can go to linzess.com, linzess.com. Some great resources there for the folks watching today.
Awesome. It's great having you. Thank you so much for joining us.
Thank you for having us.
Thank you.
Yeah, if you think you may be suffering with IBS-C or CIC, you are not alone. Important to note that. If you want to learn more, you go to linzess.com. Allergan, they are a proud sponsor of the Morning Blend.